I know what you're saying, well, what about my degenerative disc, or what about my, bursitis, or what about my hip arthritis? And I want you to kind of see that from this page that looks can kind of be deceiving from our MRIs and X-rays and scans that, lots of these people have imaging of issues in their body, but in reality, they're asymptomatic. So again, all these studies, you see 3,110 people without symptoms. 80% of them at 50 years old had degenerative disc degeneration, or 36% of them had disc protrusion. So that means that 80% and 36% of people had these quote unquote pathologies from an MRI or an X-ray, and all of those people didn't have symptoms. So that means that these pathologies, these injuries, these things that people are told are the problem or the thing that is going to stop them long term, or are being told to not do things, are actually in very healthy, very unsymptomatic people. And so it's like, okay, what's going on? Here's some more studies again. So, when looking again, 80% of the back, 45 people, 69% of them had a labral lesion without any symptoms. So again, the labral lesion is like something that connects your hip. And, these are just really to hammer in the idea that, okay, when we have pain, it doesn't necessarily indicate that there is some sort of tissue issue. And also, more specifically with these images, when you have tissue issue, disc degeneration, labral tear, disc protrusion, all those scary things, when you have that, it doesn't necessarily mean that you have to have the pain, because all of these people are pain-free people. So yeah, so just wanted to kind of right off the bat throw that out there so that you guys understand what I'm talking about, that when you have a tissue issue, you don't always have to have pain, and when you have pain, you don't always have to have a tissue issue. So it's like, okay, well, how do we figure it out then? We need to figure out what the root cause of the pain is.